I'm Dr. Jason Bowlds. I'm a general surgeon, and every week I try to bring you videos on the treatment and prevention of diseases of the gastrointestinal tract. Today's topic is screening colonoscopy. So why do we do screening colonoscopies? Colon cancer starts as small polyps within the colon, and by finding and removing these polyps before they're too large, we can prevent colon cancer before it starts. Approximately 150,000 people a year in the United States are diagnosed with colon and rectal cancer. And if screening colonoscopies were performed at the correct age, we could prevent 90% of these cancers. So who needs a screening colonoscopy? We're talking about patients at the age of 50 who are otherwise asymptomatic and low risk for colon cancer. The American Cancer Society has recently lowered this age to 45, but check with your insurance company to make sure this is covered for you. Other patients are higher risk for colon cancer. They have a family history of colon cancer, colon polyps, or they have a personal history of inflammatory bowel disease. These patients may need a colonoscopy before the age of 45, and they need to discuss this with their doctor. So what does a colonoscopy entail? Once you've set up your colonoscopy, your doctor will give you instructions for the day before the colonoscopy. You should be on a clear liquid diet from the morning before the surgery to that evening. And you will be given instructions for a laxative prep such as Go Lightly or Miralax. This again will be taken the day before the procedure. This will flush your colon out so the doctor can see your colon through its entirety at the time of the procedure. From midnight until the time of the procedure, you will be instructed not to eat or drink anything so that you can adequately be sedated. They will also tell you to hold all medications the morning of the procedure. If you are on medications that you think are important, you need to discuss this with your doctor's office to see if they can be taken the day of surgery. If you are on any blood thinners, such as those taken for cardiac reasons, these may need to be held 3 to 5 days before the procedure, so discuss these with your doctor as well. The day of the procedure, you will come in and they will start an IV and IV fluids. You will meet your doctor and then be taken to the procedure room where this will take 30 to 60 minutes. You will be sedated for the procedure. Many doctors still use medications such as Versed and fentanyl for light sedation so that you don't feel much and shouldn't remember much of anything of the procedure. Other doctors use an anesthesiologist and will give you medications such as Diprivan so that you will be in a deep sleep and shouldn't remember anything. If you know that you have a high tolerance to medications because of chronic use of antidepressants, anti-anxiety medications, alcohol, or other substances, discuss this with your doctor beforehand so that they can have an anesthesiologist present for your procedure. Once you are adequately sedated, the doctor will introduce a lighted scope through the anus and he will insufflate your colon with air. He will look for polyps, and if these are found, he will do his best to remove these polyps at the same time of the procedure. Some polyps are felt to be too large to remove without injury to the colon. In this case, your doctor will take biopsies of these, and he will discuss other treatment options afterwards. Once the procedure is done, you will be taken back to the recovery area where you will wake up for approximately 30 to 60 minutes. Once you are awake, you will need a ride home. Please know that the risk of injury to the colon during a colonoscopy should be less than 1 in 1,000. But if you are having any abdominal pain, fever, or blood in your stool within the first 24 hours after your procedure, please inform your doctor's office. If polyps are found during the procedure, or if you're high risk, such as those with a family history of colon cancer, you need to have a scope at least every 5 years. If you are low risk for colon cancer and no polyps are found during your scope, you should have a colonoscopy every 10 years. As to the cost of a colonoscopy, this should fall under screening measures for insurance purposes, and they should cover this at 100%. Some patients may get a separate bill from a pathologist if polyps were sent, or a separate bill from anesthesia if they were necessary. You may want to discuss this with your doctor's office beforehand to make sure these are covered as well. If this topic has been helpful to you, please subscribe to my channel below, and in the comment section, please feel free to add any topics that you would like to hear more about in the future. As always, I'm Dr. Jason Bowlds, bringing you better health through better education.